Welcome to the Morris County Chamber Forum on the Business Task Force with Senator Bucco and the Morris County Chamber. This is an official function of the Morris County Chamber Government Affairs Committee. I'm Alan Zakin. I'm volunteer chair of the Morris County Chamber Government Affairs Committee, run a PR and government affairs firm in Florham Park. And we have a big agenda, so I don't want to delay. This particular forum, there are other plans and recommendations out there, but this one in particular distinguishes itself. It brings objective scientific analysis to the marketplace of ideas, and we're going to have our collective businesses led by Senator Bucco advocate for these ideas in the public forum to add to the debate in a constructive way, and we look forward to all of your participation and feedback in that. And I'd like to first thank our sponsor, Tilcon, who provides a lot of our public affairs program. We have Josh Benson from Tilcon here. And Tilcon's a leading construction and manufacturing firm where safety remains their #1 priority, appropriate for this forum. And they support the Chamber and Senator Bucco's initiative to ensure other industries can open, enabling them to also serve our community safely and effectively. And with that, I'd like to turn it over to the president of the Morris County Chamber, Meghan Hunscher. Meghan?
Thank you, Alan. Good morning, everyone. I hope that this finds you well. As Alan said, I'm the president and CEO of the Morris County Chamber of Commerce and Economic Development Corporation. I'm proud and excited to welcome all of you to hear this important presentation of our task force report. I know our task force has been working tirelessly these past few weeks to put this together. As many of you know, the Chamber has been remote since mid-March, since many of you have as well. Our mission remains the same. How we fulfill our mission has changed, however. So during this health emergency, we've become a virtual chamber, so we're glad to be able to bring these seminars and events and important government affairs committee meetings to you virtually. So thank you for participating. We are Facebook Live, so we are reaching those in the business community far and wide. Again, as a chamber virtually, we continue to convene, facilitate, educate, advocate on your behalf. Unfortunately, we know this is a very difficult time for businesses. We have heard from a few that have decided to permanently close their doors. And obviously, we're looking to stave that off with a report such as this, which as part of the Morris County Chamber and also the larger business community, these businesses are truly hurting. And so we are proud, as I said, and excited to be able to bring some thought leadership to this initiative. As for the background and purpose, we understand there are many task forces, and we're fortunate in New Jersey that we're one of the most educated states in the union. And so we're fortunate to have some great minds be able to come together and advise the administration and the legislature on next steps that are both practical, realistic, and important for our business community. So I would like to thank Senator Bucco for his leadership and his advocacy on behalf of the business community. I'd like to thank Michael Stanzilis for taking the lead for the Chamber, and Bruce Groves of Emilcott for chairing this task force, and for all the members of the task force who have spent their time on this. Greatly appreciate your input. So thank you very much.
Thank you, Meghan. Just about 3 weeks ago, I reached out to the Chamber for assistance in assembling a panel of independent, nonpartisan experts and business leaders from each segment of the economy to help develop a plan to reopen New Jersey. Today, we will release that plan. I want to thank the Chamber for assembling such a wonderful group of business leaders and experts. We wouldn't be where we are today without the Chamber's full support and help in moving this project forward. And it says an awful lot about the Morris County Chamber and its dedication to the business community. I also want to take a moment to thank the task force. It was a great group of business leaders from all over the county, led by Bruce Groves, Joni White Wagoner, Dr. Deborah Bersardi, and Mayor Mike Stanzilis for your expertise and advice in help guiding the committee and developing this, what I believe is a very important and thoughtful plan. We are at a critical juncture here in the state of New Jersey. In fact, we may already be past critical at this point. For the last 2 months, New Jersey has answered the call from public health experts and the governor to stay home, to practice social distancing when necessary, and to wear masks when entering indoor spaces. With the critical work of our frontline workers and first responders, we're seeing the curve beginning to flatten. And while that important work is taking place, we're also seeing eye-popping unemployment claims. I'm hearing from businesses every day who have to make difficult choices as to whether or not they are going to try to hold on or permanently close their doors forever. We all commend the administration's efforts to protect the public health, safety, and welfare of our communities. But I think time is running out on many of our small businesses. We want to see equity and clarity in the policies coming from Trenton for its all businesses, not just the big ones. We want to be able to provide some guidance to the administration about how we can balance both public health and economic health quickly. And that balance is already happening today, as we see long lines outside of grocery stores, Home Depots, Walmarts, while most lower or of equal risk Main Street businesses remain closed. That's simply not fair. The longer we wait, the greater the impact. The ripple effect that will occur from this economic crisis will have a terrible effect on our state revenues. And what that means down the road for long-term unemployment claims and traditional state line items like school funding, social services, property tax relief, higher education, and more. We simply just can't afford it. We believe this plan uses both facts and science to get New Jersey reopened safely and quickly. And those are the two key words, safely and quickly. I want to introduce now the chair of this effort, Bruce Groves. He was pressed into service by the task force to help put this plan together. He's the president of Emilcott and Associates, based in Florham Park, which is an environmental and occupational safety consulting firm. And he is a certified industrial hygienist who is well respected in his field and by his peers. At this time, Bruce, if you would begin to explain the plan to those that are on, I think that they will find the approach that was taken enlightening. Thank you, Bruce.
Thank you, Senator. I'm going to share my screen, so bear with me here so I can do what everybody's been doing with Zoom calls to try to do it as seamlessly as possible. Okay. As the Senator said, I am an industrial hygienist, which actually is not a well-known term, but basically my whole career is to conduct exposure assessments that deal with workers and the public, then to identify and conduct hazard assessments. At what time are these exposures going to become a hazard? And once you've identified the hazard, then identify means to control this hazard so you can get these risks down to an acceptable level. This can be done with the COVID-19 issues, and that was the approach that we proposed to the committee and said, let's take a risk-based approach, and I'm going to walk through a number of slides. There is a narrative here that kind of explains certain things in detail, and I know we're going to have some questions at the end after a couple of testimonials about some of the situations that people are in. First, this is a picture of the committee itself. It's a great group. A lot of them are involved, heavily involved in all sorts of different types of industries here in Morris County. Now, to start this, I wanted to tell you that you really can have these three goals coexisting, and that's to have a healthcare system that's ready to be prepared for any type of uptick or any kind of surge that may happen going forward. We all want to make sure that we have a safe workplace and safe public spaces, and we can get everybody back to work. And the takeaway from this presentation is that we're ready to open up the economy, at least here in the regional area, and get people back to work. As Senator Bucco said, we chaired this with three people from a technical. We took a science approach, the group that we have is me and a toxicologist, Dr. Barsotti, and Joan White Wagner, who has had various leadership roles in the healthcare industry. So the first two questions: how do we know it's time to open the economy? And when it is time, how do we do it safely? Now, how do we know it's time to open the economy? We decided to use what is the CDC criteria, and the CDC criteria looks at really three different various silos here. What kind of symptoms are out there with regards to the illness? How do we capture the metrics of how many cases? And how good is the healthcare system in being able to control and to treat people who might be sick? And if you can look at this chart, basically, we looked at something that called the ILI, and I'll talk about that in a minute. You have various COVID-like syndrome cases. They have dropped. And so the next slide basically is what is known as the influenza-like illness. And this is a tracking data system where basically they're counting heads of people who come into an emergency room that have some sort of influenza-like illness. May not be COVID, maybe something else, but at least this is a tracking issue, and you can see that that has really dropped significantly. It's the week ending May 2nd, so this goes back into April, started the peak, and then we're done. Symptoms of COVID-19, this is the COVID-like symptoms. You have a downward trend. We identified the peak here in Morris County about April 14th, and you'll start seeing new cases in South Jersey have peaked pretty much around April 28th. Now we have actually documented cases, people who have tested positive for the COVID-19 virus, and that also shows that that's in a downward trend. So this is data that supports the CDC criteria that it's okay to come out and start to get the economy moving again. The next thing we looked at were hospitals. And when we talk about the preparation of hospitals, we leaned on the National Institute of Health has crisis care definitions, basically measuring what the conventional capacity of the hospitals are at any given point in time, what kind of contingency planning, and if there was a crisis, how are they able to respond to a crisis and an uptick of people that are going to put some sort of challenge on the resources. And from all measures that we have right now, the hospital system is out of the crisis mode and is ready to actually get back to work. So we got these numbers last week, and this is just on Morris County. That kind of reinforces what we were talking about, and that we've had significant declines. In this case, there was a peak of 204 COVID-19 cases daily in one day, and now we're down to a daily average of 52. So it's a significant decline going downward. When you talk about testing, and this was at the County College area, that there were 320 daily tests at a peak, and now they're averaging about 85 per day. The good news is, of these tests that are occurring today, the positive results are dropping from 43% to 15%. So we think that the data is supporting the timeline that we can say there's not going to be a zero risk at this point, but we can move forward and try to open up businesses as quickly as possible. So how do we do this? This plan has taken an approach that we wanted to not necessarily look at industry across the boards as having the same risk, but try to identify each industry sector, each business of what is the potential transmission risk. The transmission risk is how is the virus going to be transmitted from one person to another. And we wanted to quantify that in what we call the scorecard, a business risk ranking. And once we've identified the business risk ranking number for each industry, then you can look and determine what the mitigation steps for each one of these businesses. And lastly, when we have determined the business basic mitigation steps, this was a generic outline of what we feel needs to be done if you're at a certain risk. But we know that you got to take this generic step and you have to make it very prescriptive from an industry, from business to business, because each business is going to have its own unique issues that they want to address in the procedures that they want to develop to try to control the risk. The first step was this scorecard, and just as a introduction for many of you is that the Bureau of Labor Statistics has identified industry codes that are used in the financial industry, that are used in insurance and all sorts of issues. And these codes are 6-digit codes. You'll see here the 2-digit codes for the various industries. So mining's 21, construction's 23. What we did is we decided to use 4 digits, and that came out to 312 separate codes. And when you start looking at 4 digits, if you look at construction, for example, and you go 2 more digits, you can get a little bit more granularity in identifying difference between major construction, highway construction, residential construction, and any business that is in these areas can cross-reference and see what their 4-digit code happens to be. With this 4-digit code, in these 312 different industries, we decided to develop a risk ranking. And the risk ranking, the mission was to make it as simple as we can. And to make it simple, we decided to back into a risk ranking system that was developed by OSHA, who developed a guidance document for the COVID-19 illnesses, the viruses, and they ranked it from 1 to 4. Well, we modified this a little bit because we're not only looking at workers, we're also looking at workers, transmission from worker to worker, worker to customer, and customer to customer. So we still use the 1 to 4 system. We just called it a little different. We had different criteria. This originally came from a collaboration with the chamber out in Wisconsin, who developed the initial part of this process, and they called it a back to business approach. And we like the approach, we like the philosophy, and we built on that to develop a ranking system for both worker to worker and when customers get involved. And we brought our team in to do a QA of what they did and to modify it. And this is what we're presenting today. So from a risk standpoint, when you're calculating transmission risk, you basically have the paradigm that's really quite simple here is what is the risk, what's the probability to get this virus and to contract the disease, the illness, I should say. And that equals the hazard, getting exposed to the virus times exposure. So the virus is the hazard, and then you have exposure. And exposure is dependent on frequency and duration. So you have frequency can be proximity to a person that may be contagious, but it doesn't happen right away. I mean, there's a time factor. So those people that pass, and you're passing someone that's a short period of time, that really, really reduces the risk. If you have close proximity for a frequent time, then you have a much higher potential of risk. The two risk scores that I mentioned, workers only, and we looked at when customers get involved, workers and customers. So this is the criteria that we based it. It was a little more detailed than this, but this is a simple area where we have number one is a minimal. And basically the criteria was in this area, in this workplace, the people do not have frequent or close contact with coworkers or the general public. And that's, we found to be the majority of the industries out there. Moderate is you have frequent short-term contact, we said passing, but you can usually effectively maintain your self-distancing. Significant is where you have frequent, sustained 4 to 8 hours a day with coworkers in the public, and often not being able to maintain self-distancing of 6 feet. And I'll give examples of this in a minute, so we can make it a little clearer. And the last one is high, and these are jobs where you're required to have contact with sick people, with people that are known or suspected to have the virus. And this is really mostly emergency workers, healthcare workers, anybody who are dealing with transporting COVID-19 patients, things like this. So the big focus for this group, which covers 95% of the industries out there, is 1, 2, and 3. And this is the bucket that we put all the industry sectors in. Here's some examples of risk levels, just to make it clear. We identified that minimal risk, where people don't necessarily need to have close proximity of other workers. And you have to understand that there's always an outlier. There's always something that you say, well, in this case or that case. We're talking about the majority of the work that's being done. And if you haven't noticed, people are changing their behavior right now. If it was 2 months ago, you may have people that were not trying to self-distance. Today, people are doing their best they can to keep away from people unless there's an occupational need of some sort. So we decided that most construction would be minimal, most manufacturing, motor vehicle manufacturing. I was going to tell Elon Musk that he's a minimal level, because I know that he's upset about not being able to keep his car manufacturing going in California. But here we have, and I have the asterisks on most construction, because you remember non-essential construction was shut down a number of weeks ago. And I'm not saying it's a wrong thing to do. That was the crisis when everyone wanted to kind of shelter down and see what happened. But now's the time to say, okay, it's over. The crisis is over. Let's get back and look at really what the potential risk is for these various types of industries. Moderate, I put in some retail, jewelry, florists, lawn and garden shops, car dealerships, at least letting people into the showroom, banks. There's a whole bunch of different types of industries that we consider moderate. Significant, other retail, grocery stores would be considered significant, liquor stores would be considered significant, department stores, shoe stores, airlines, restaurants and bars, schools. I have the number 45 and 52, which I'm not sure this is a totally accurate number. I think it's larger than this, but in Morris County, we did a little head count to see how many grocery stores and how many liquor stores remain open during this whole pandemic. And if you look at and you know, they've remained in, if you look at the ranking they're significant. And they've been open. People have practice self-distancing. I think they've been vigilant going into these stores, and you're still seeing a significant drop in the illness over the past many weeks. And what this slide shows is, though grocery stores is significant, have been remained open as an essential grocery store, you have other retail that are moderate that have remained closed. So we're trying to right this wrong and open up all those businesses today that are minimal and moderate, and open up the significant ones when they have their mitigation steps in order, which could happen very, very quickly. High, we have physicians, dentist offices, hospitals, nursing and long-term care as examples. Now, what are the mitigation steps we're talking about? So if you go back and you say, okay, I'm a construction worker, I run a construction company, it means that you want to do at least these things, okay? You want to make sure that you tell people, you tell your construction workers, if you're sick, stay home. Some construction sites actually are having a gatekeeper taking temperatures, making people answer questions about their current situation, their current health. You can work from home if possible. You want to have some sort of training program on best practices and procedures. There will be some sort of workplace assessment, limiting, changing the environment so people can be successful to try to self-distance as easily as possible. Some routine cleaning, disinfection. There's a messaging you want to have with regards to procedures and what you expect as an employer or as a business, either from workers or the public that are coming into your place. And you want to limit these congregating areas, common break rooms. And so there's some change in the environment, but not major change. The second level, and we were talking about some retail operations. I mentioned jewelry stores and showrooms of car dealerships, and that you will have some sort of PPE assessment for the customers. And a lot of this is, are you going to have people, wearing gloves? They're going to have people putting on a mask. And in this case, masks have been mandatory. When it came originally through the OSHA guidance document, masks at the moderate level were not mandatory. In fact, they were not even recommended. But now we're talking about having PPE where people are wearing masks. It may not be N95 mask. It may be the surgical mask that most people are wearing or such. But then, whatever the business feels works for their environment to meet the need. You still have maybe expanded routine cleaning. You're going to limit the occupancy to 75% of your fire code capacities. Some staggered shifts, maybe work from home, reduce the numbers, reduce the population in your work area, and you may have a gatekeeper. And this is where you are seeing more gatekeepers. Now, gatekeepers for small retail operations, again, could be self-reported, that please read this line or possibly, I've had groups where they actually check off a few boxes that say, no, I haven't been ill, I haven't been out of the country, and so on. The third level is the more substantial level. And if you see the parentheses below substantial, we're recommending that you go to level 1 and level 2. You're doing all those. And you're also adding not just a PPE assessment, but now you have mandatory guidelines of such, this is something that you're requiring all your employees, and you often may even require some of your customers. And you can't control the customers in a lot of cases with regards to personal protective equipment, except for the mask is now becoming more common as being a requirement before anybody walks into one of the facilities. You see some employee entrance screening. Again, this might be limited to temperature checking and asking people to self-report. There's also an important aspect to have some sort of response plan for positive employee cases. One of the things that occurred in the beginning is if someone was tested positive or had symptoms of COVID-19, then workers or employers didn't know what to do. So they would take an action of shutting the operation down or coming in for deep cleaning and shutting it down for 14 days. You're starting to see a less of a draconian type step, but it's still important to have a response plan. How are you going to handle the messaging? How are you going to handle your workplace when someone is positive for the COVID-19 virus? And we also were talking about limiting numbers of non-employees to 50% of the fire code. This is the first step in the phase to get people back, get the economy back moving. It is the most conservative step. This 50% of the fire code is a conservative step, which can be lessened as we start seeing success out there. We start seeing the numbers continue to drop. We're not, as part of this plan, identifying what needs to happen to go from the first step, phase 1, to phase 2. I think that can happen, reasonably soon after we get success in opening up the economy again. But I think it's important to recognize that it's good to be judicious and be conservative as we start. This area, the step is, the plan actually has the scorecard, as I said, which basically can give some consistency. So you can look at all businesses and you can quantify and determine what their risk level happens to be, and be more targeted in trying to develop a program. We know that a lot of industry groups, you've seen a lot of plans. We've seen different associations have come out with all sorts of industry-specific requirements, which is good. What I recommend is look at these requirements, referencing this to our mitigation, generic mitigation steps that we've identified for each risk level, and make sure that they coordinate, that at least these industry groups meet the generic requirements in our plan. We also recognize that there's a lot of companies out there, a lot of businesses out there that really don't have the resources, the association resources or industry resources to develop a plan may have not developed. So we're looking at getting a baseline approach, some generic, taking the generic requirements and putting together checklists that companies and businesses can use, that they can develop procedures that work for them. I mean, they know their business better than we do, that still meet the generic requirements under the mitigation steps. So the next steps is to identify and try to inventory all the different plans that people have. We want to make sure that we can identify organizations that can provide resources to help those businesses in need to put together their own kind of business-specific requirements. And this can be done very quickly. It's already out there. But I think that there is some sort of level of effort that needs to be done in order to be prescriptive to meet the needs of each specific industry. What's the good news? When we did this, we really didn't know where the risk levels were going to end up, but where it ended up is that 80% of all industries on this 312 four-digit scorecard, 80% were either minimal or moderate. 70% were minimal. And from my perspective, there's no reason that either one of these areas shouldn't open tomorrow. The procedures that need, the mitigation steps that are needed to move forward are not that complicated. It won't take a lot of resources. It takes a little bit of smarts, but I think if they haven't already been thinking about it, this plan outlines the steps. 15% we've identified as a risk baseline of significant. Now, the inconsistency, if you want to call it, is that these are much higher than the 80%, of which many of them were closed. But they've been working, and they've been operating safely through this pandemic. If anybody's been in a grocery store over the past 8 weeks, you've seen the evolution of controls that are being put in as people start to see what's needed. And there's no reason we can't do the same thing for every industry that is also in this significant risk level. The last is the 5%, mostly healthcare related. And I'm not dealing too much with the specifics on there because there's a lot of resources that are being supported at this point for that industry. So that's the plan. I think we're ready now. We meet the CDC guidance to reopen, and I think we can immediately get a regional phased approach to reopening based on our baseline risk rankings with specific industries. So thank you very much. I'm going to stop sharing this. And I'd like to pass this over to Jim Ott and to Amanda Vienot. I'm not sure if Jim or Amanda is going to speak first.
Go with Jim first.
Good morning, all. How are you? So we have multiple car dealerships in the state of New Jersey, several in Morris County as well. And we have the unique situation of being in where one part of our business was considered essential and we were open in the beginning. And then as time went on, they let some kind of controlled environment go for sale. So we're able to sell cars online and by appointment only. So we've had a lot of broadness in how we're doing business. But the most important thing was how to make the place safe and how to get it to a point where we can open and feel like customers can be safe and employees can be safe. And when you take the right guidelines and you take the right steps, it's very easy to do. We have large showrooms, we have large service areas, and it was, we separate the people so everybody's more than 6 feet away. We have plexiglass barriers for any kind of contact point, cashiers, receptionists, salespeople. Everything's kind of done in a private office and things of that nature. So, I think when you look at most businesses, it really is time, certainly in retail, where you can open and you can open safely. Yes, there's certain things you have to do, and I think everybody has to take a responsible approach to it. But I would, clearly say that most businesses are going to take an extremely responsible approach to it, and be able to get themselves open. So.
Thank you, Jim. And I'd like to introduce Amanda Vienot of Momic.
Hi, Mike. Thanks, everyone. I'm Amanda Vienot. I'm the founder and CEO of Momic in Morris Plains, technically in Parsippany Township. And we are 2 years old. Just a very quick backstory. I opened up Momic when I was pregnant with my first child, and my world shifted from serving the military community and private equity in Manhattan to becoming a mom here in Morris County. So I sold my one business to reinvest the profit into this physical motherhood center and maternity boutique in May of 2018, pouring all of my family's life savings into this business with the hopes that we would start becoming profitable on May 12th of 2020. Well, May 12th of 2020 was this past week, and we were in week 8 of our shutdown. My husband and I, unfortunately, had to make the very hard decision to close our doors for good, because after pouring hundreds of thousands of dollars into this business, we just can't sustain this shutdown any longer. It's it's heart-wrenching, it's heartbreaking. If you go on our Facebook page, you can read hundreds of comments from local families that are devastated that our business is shutting. It's not just affecting us, me and my husband and our 2 girls, but it's also affecting dozens, if not hundreds of families that relied on us for social, emotional, mental, and physical health and well-being for their family journey from the point of pregnancy through motherhood and fatherhood. It's really upsetting. I wish there was more that could be done or was being done sooner rather than later. I know this is the first time that we've all experienced this, and we're now the case study for moving forward on how to do this better in the future. I've shared some of my ideas with Mike and some others in terms of how businesses might be able to survive this, like mine, that are very small retailers, that are single owners. You know, the curbside pickup for small retailers is great in theory, but I had 5 part-time employees. I had to lay them all off. There's no way I could hire them back doing curbside pickup because it's 25% of our revenue that we would be able to gain back based on what my advisors are saying. So 75% of our revenue will be lost in the very short term or in the longer short term, probably within the next 12 to 18 months. And that's just not sustainable for small businesses like ours. So again, it's very unfortunate. It would take an absolute miracle for us in the next 6 weeks to be able to reopen. And with that, my husband and I decided that we would shut.
Thank you, Amanda. It's a really tough story, and you know, I'm sure we're all hearing lots of stories like that throughout the state. So right now we're going to open it up to questions and answers, and there's a Q&A tab on the bottom. If you hover your mouse over the bottom of your screen, you can type in your questions in the Q&A, not to be confused with the chat. In the meantime, just one other quick announcement. The Government Affairs Committee and ELC will be having a meeting with Assembly Leaders Zwicker and D. Phillips on the 29th of May at noon. And they're the co-chairs of the Science and Innovation Technology, and they'll be discussing the latest findings in science, innovation, and technology. That's May 29th at noon. So here we go with questions for the panelists. I think we'll start out with the obvious question we get from a lot of people is, you know, what risk factor, Bruce, do I fall in? And there's a lot of people on the call that are representative. They're working in small offices, like us at the Chamber, or a small law firm or a real estate firm. So they're wondering where they fall with the NAICS code and what's their risk level.
Well, we have the list. The NAICS code number, the 312, and my understanding is at the end of this presentation, that list is going to be made public. So the simple answer is if you know your NAICS number, and you can get this off your tax form, your type of industry, and some industries may fall into a couple NAICS numbers, and a good example could be car dealerships that have a retail side of it. They also have a mechanical side, you know, a maintenance side of it. So these may be 2 different risk levels with regards to trying to determine your transmission risk. We looked at offices, and offices are either minimal or moderate, depending on the type of offices you get, because you have the freedom to practice some distancing, but you know, and if you have a high density office, some changes may be needed. You might have to stagger shifts to reduce that density. You may have to put in some sort of barriers with regards to an open seating area. You try to administratively control distancing as much as possible without having to spend money on you know, some sort of change to the environment, you know, desks and such like that. But most people feel that that, you know, from our risk levels is that you're not going to, they would not push them into the significant level.
Great, thank you, Bruce. So this is probably more towards Senator Bucco. Somebody wants to know, when do you think the malls will be allowed to be open, and when you speak to the governor, does he give you an indication of what he's going to be opening next?
Well, first, let me answer the second part of that question. No, the governor has not given us any indication of what's coming next. And that's part of the problem. You know, businesses need time to prepare to open. And a longer lead time by the governor's office would be very helpful to many businesses. Just over the weekend when boat rentals were allowed to resume again, I know many of the marinas were scrambling to prepare to begin to rent vessels. So one of the things that I will be discussing with the governor's office and the governor is that we need to have a little bit more lead time before he issues these next executive orders opening up more businesses. And I think that's the beauty of this report. And I intend to send this report to the governor and to his task force to ask them to consider it, because I think that this piecemeal approach just isn't working. And it doesn't make a lot of sense. There's a lot of inconsistencies as to why one business is open and another is not. This fact and science-based report and conclusion really gives the governor the opportunity to say, okay, based on what we've seen, based on the facts that we know them today, and based on the science, the risk factors involved, there's many other businesses that could open, and we need to start heading in that direction. And the malls included. You know, to say that there's curbside pickup at a mall, you know, just really isn't helping anybody.
Great, thank you, Senator. This next question is along the same lines as your answer, but I think it's really well worded here. And it says, "Thank you all. While the president disappeared on me. The plan to reopen is great. How do you get the governor to agree to do this? He keeps on issuing new executive orders that are harmful to the state's economy, citing science and data. These fiats are unconstitutional because they apparently actually have had no basis in science and data. And of course, what you're doing is based on science and hard data."
Well, I agree with the individual that wrote the question. Many of the executive orders do have provisions in them that I think are unconstitutional and would be found unconstitutional by the courts if challenged. The courts do give great leeway in times of emergencies such as this, but you know, there's a provision in the Constitution that says no law can interfere with a contract, an existing contract. And essentially, many of the executive orders, at least some of them, have done just that. So I think, first of all, there are aspects of the executive order that would be found unconstitutional if challenged, and that may occur depending on how far down the road we go with this and the economy remains closed. How we get the governor to agree? Well, you know, the governor shut the state down based on facts and science, and this report gives him clear ability to open it back up on those same facts and science. So, you know, I hope that other legislators will have an opportunity to review this report, especially those legislators in Morris County. I hope that they will join the chamber and join me in advocating for this. It's critical at this time that, you know, that we begin to get the economy moving again. Because as I said in the opening, the ripple effects from a down economy are long lasting and will have impacts across the board. And in fact, we're seeing it, that the budget is $10 billion short. So the only way to correct that and to put New Jersey back on its feet is to get the economy moving again quickly and safely. And I think this report proves that we can do that, both based on the facts and the science, which are the same things that the governor used to make his decision to shut it down. So at least now from this region, from Morris County, it looks like we're at a point where we can move quicker than what I think the governor is anticipating. And don't get me wrong, this report was not designed to be antagonistic towards the governor or the administration. It was done, as I said, with independent, nonpartisan experts and business owners to simply show that there is a path forward, and that path can be done and proven it can be done safely and effectively. You know, as Bruce indicated, 80% of the businesses that are closed now are less risky to operate than the businesses that have been open all along. You know, when you look at grocery stores and Home Depots and Walmart, where folks are going in there in record numbers, and you compare that risk, the highest end of the risk factor, to small Main Street businesses that have a much lower risk, we certainly could open them up and still continue to see a flattening of the curve, because we've been operating for 2 months with the highest risk companies in business. So clearly, this report, I think, opened a lot of eyes for all of us that worked on it, and that particular fact that 80% of the businesses that are closed are less risky than those that are open was one of them.
Yeah, that's an incredible key takeaway. If you're going to walk away with one thing from this entire session, that certainly is it. We have a lot of elected officials, mayors, freeholders. We have municipalities on the line here. The underlying sort of ripple effect that you mentioned, this next question sort of touches on. And this is, what discussion, if any, is occurring for landlords to receive some relief? The stay on evictions will only delay the inevitable conclusion of potential mass evictions without some form of rent relief being paid directly to the landlords. Now, as an aside, also this does affect municipalities down the road in terms of their tax revenue.
Well, the legislature is looking at the rental side of this economic crisis, and I know the EDA is also looking at it. So that has not gone unnoticed. I do believe, we talked about it earlier, about the unconstitutionality of maybe some of these executive orders, but I do believe that one of the things telling tenants and landlords that they have to reform their contracts that are already in existence, I think travels down that road of unconstitutionality. So that's one of the things. But I do know that the legislature, I've spoken to my colleagues about this, and I do know that the EDA, Economic Development Authority, and the legislature is looking at that side of the equation.
Great, thank you. Are there any parties working with Unlock New Jersey, Senator? And you know, you had mentioned earlier there's a lot of different plans out there, so there's synergies, and this is definitely not working against other plans. But this is specific to Unlock New Jersey.
Yeah, I mean, look, there are many groups out there, some that were formed a while ago, some that are just now recently being formed. I think it's our goal to partner with as many of these groups as possible to elevate the urgency and the need for a safe and common sense reopening of the economy. I hope that these groups will take a look at this plan, especially those that are in Morris County. This plan is coming out of the businesses that are here in Morris County and in the surrounding areas. And, this is essentially what the business owners are saying. So I hope that those other groups are willing to take a look at this plan, and we're more than happy to accept any input from anybody else in order to get this moving. But I think it needs to be a joint effort, and I'm not saying this is the best, but as Alan Zakin said early on, this appears to us to be the first has a scientific effect, scientific analysis of what the risk factors are in opening these businesses. And I think that that's an important factor here that folks are going to want to consider, because one of the things that were mentioned early on in the task force is that people are going to, once the economy opens, people are going to return to businesses only if they feel safe in doing it, right? You're not going to go into an establishment if you don't feel that establishment is taking the proper precautions to keep you as a customer safe. If you're an employee of a particular business, you're not going to want to go to work if you feel that the employer isn't taking the steps to keep you safe. And I think that's why this plan presents such a workable solution to this problem, because it's based on those risk factors. And if the various industries develop the protocols, because they know best how to run their business, they know best how to take care of their customers and their employees. If the various industries develop the protocols that the administration can say, yeah, that's acceptable, that works, open up. This plan will mean that the economy will open that much quicker, because many of these industries have already developed those protocols. So we need to now start compiling those protocols, attach them to as this plan, and start opening up the economy. And it can be done safely and effectively and quickly, and it will keep the customers safe, the employees safe, and help these business remain solvent. You know, the story you heard from Amanda before was heartbreaking. But this is what we're hearing all over the county and all over the state, for that matter. That's why I said in the beginning that, you know, we're at a critical juncture here, but we may already be past critical. When you hear someone like Amanda say, you know, I was expecting to get to profitability on May 12th, you know, that says a lot. It's been 2 months. It's been 2 months, and with the most riskiest businesses during that 2 months operating, it's time that we start to pivot to opening the economy and doing it in a fashion that people can remain healthy and safe.
Thank you, Senator. And there's a few more questions. I just want to reiterate, as Bruce did earlier, that the NAICS codes with the associated risk factors will be sent out and will be made available after this meeting. If you can't find it, just reach out to any of us at the Chamber and we'll definitely help you. This next question is probably best suited to go to Joni. And what is the latest regarding availability of rapid results testing? Cleaning services will be better able to reopen if their clients know that a rapid results test shows that the day before they appeared to be clean for a client, and then they've tested negative for COVID-19.
Currently, right now, there are numerous commercial vendors for testing available, as well as through the healthcare sector. So I would point that back to your county Department of Health for where their availability for their testing sites are.
All right, thank you. This is the next question. Is kind of long here. It's more of a statement with a question, but it's a hair salon. The employees are currently working at Walmart or on unemployment, and this person has converted their salon into a safe social distancing environment. And there's a lot of factors that she's done. Incredible amount of work putting in here to make sure that they're really, really safe. So her question is, she was given the PPP and it's deposited into her account on May 12th. They've had good news of not having any new COVID-19 in a couple of weeks. The question is, how am I expected to pay employees who are currently receiving money from other sources with no opening date in sight, yet required to use the PPP within 8 weeks of its approval? So that's the first part of the question, because apparently, you know, she may not be fully utilizing the PPP for what it's meant for because her employees are working elsewhere. And then what risk bracket do you consider hair salons to be in? And again, the NAICS codes will be sent out shortly.
Let me take the first part of that question, and then maybe Bruce can jump on the second part. In terms of the PPP, this is definitely a problem that we're seeing around the state. And I've had communications with our congressional delegation because this is a federal issue, not a state issue. And I've indicated to our congressional delegation that this is an issue they need to take seriously, and they need to build into this next the next piece of legislation that comes out of Congress. We need to make sure that either they extend the time period for use of this money, or they somehow change the requirements so that folks like salon owners and other folks, car dealers, can utilize these funds. It was meant to help save these businesses. And unfortunately, the requirements and the short period of time have caused real problems in being able to utilize that money for its intended purpose. And as a result of that, that's something that our federal elected officials are going to have to address. And I hope they do. I understand that there was something in the initial bill that the House of Representatives passed last week. We all know that that bill is dead on arrival in the Senate. So I encourage our elected officials on the federal level to start to work together to come up with some common ground so that these businesses can utilize that money effectively and efficiently.
Great.
Bruce, if you want to talk about the risk factors for a salon.
Yeah, I think this is a great example here, in that a hair salon, if you look at the criteria, you have to get within 6 feet. You're with a person for more than passing, so that would be a significant number 3, just like a grocery store. But more importantly, it's not to stigmatize or to say that this is unacceptable to open. We basically say we now have a blueprint, and it sounds like the owner of the hair salon has already taken steps. What she can do now is look at the generic criteria in our plan, look at what she's already put together, and check it off. If she's doing everything that we want her to do, if there's a process and it looks like she's pretty comprehensive, then she's ready to open tomorrow, from my perspective. So that's the purpose of the plan. You know, it's not a carpet bomb approach where every industry has to do the same thing. You know, we have a judicious, clear guidance so she can justify and support and defend that she can open safely.
I agree, Bruce. And again, you know, I can't reiterate this enough. This recommendation came from independent, nonpartisan experts that took a look at the science behind this virus and are now looking at the facts and saying, look, we can move forward safely. There's some precautions that we have to take, but we can take them and move forward. And it's not a carpet approach. It allows each industry to mold the response to their particular industry. I've said this a million times, nobody knows better than those that are on the ground running their businesses on how to respond to these things. And I think that that's exactly what this gives us an opportunity to do, both from a chamber's perspective, but also from a governmental perspective. You know, Trenton can respond to this now, I hope, and push it forward, because there are many businesses. I know Mayor Hoven and Mayor Asdale are on the phone from the Chesters. They have been tremendous advocates for their Main Street businesses. They've got a beautiful downtown and in the Chesters, and those folks are struggling. So that's why I think that it's really critical that we get as many folks behind this as possible to make the administration understand that this is a viable solution that can help right our economy and move us forward.
Thank you, Senator. This next question is probably best suited for Joni, and it's, what about the virus being transmitted via AC or HVAC, and how the filtration systems are going to be set up to accommodate this? And then same person asks, what PPP should we wear if we go to the doctor's office?
I can talk about the ventilation, Joni, if you want me to do that.
Yeah,
Sure.
she actually asked a couple questions about healthcare. I can answer those and then bounce it back to you for the air conditioner, because I can't answer the filtration question. So I know that Joanne asked a couple of questions. CDC.gov has a list of guidance and healthcare guidance and criteria for healthcare workers and their patients. I would suggest going to their website because they update it all the time based on new data and new science that they are developing. Currently, the CDC nor NIH has not have any designation for a threshold of when to shut down again if there's another future outbreak. What NIH crisis care guidelines, they're implemented when the healthcare resources are anticipated to be stressed. At that point, I anticipate the governor would then execute another executive order when he sees that they are being stressed. However, I do want to note that healthcare industries across the nation and in New Jersey are developing plans right now for future outbreaks to help mitigate those stressors that would come on the healthcare system. And Bruce, you can answer the filtration.
Yeah, I knew we were in trouble when that famous pathologist, Anderson Cooper, started talking about getting the virus off of lettuce. And he also brought up the issue of buildings and ventilation systems, and you could just see the horror movie that could occur going in. The fact is, social distancing works. And the reason it works is because the major transmittal of the virus is the close contact between someone who is infected. You can't get better social distancing than a building with a ventilation system. So the stories you hear about viruses getting in the basement and getting through are just not true. Companies still, though, are looking at trying to make modifications, and this is something that is not a bad idea, to start looking at how many changes of air per hour, and there's a whole scheme you can do to try to improve the changes in air. What sort of filtration do you want to put in there? They have what they know as high efficiency particulate aerosol filtration, which actually does stop the size particle of a virus. This gets the quality maybe from the high 90s to even higher 90% with regards to safety, but it's also a good messaging to people that are in here that we're taking these extra affirmative steps. And it just reinforces the commitment of a lot of companies to say we want, safety is very, very important.
Great, thank you. I guess this is more of a comment here, but it seems that this is the person writing. It seems to me that which businesses had to close and which were allowed to stay open or continue operating was mostly unfair. How can this be studied and fixed? And I believe, Bruce and the Senator have really addressed that quite well during this call, but you can certainly go back and reiterate that a little bit more if you care to.
I just think again, when we started out down this road 2.5 weeks ago, 3 weeks ago, we didn't realize that when we got to the end, that we would see that 80% of those businesses that are closed have a lower risk factor than those that are open. And when we started to recognize that, it became absolutely clear to us that yes, it's not fair. There is no question it's not fair. And I hope that when we deliver this report to the administration, that the governor will now recognize that as well, and take action on it, because it's the fact. It's a fact, and it's the science. So I don't know where you turn to say, well, it is fair, because it's clearly not. I mean, clearly when you look at the industrial standards and when you look at the science behind it, as Bruce and this panel of experts put together, you see clearly and quickly that it's not fair. It's not fair that 80% of these companies that have a lower risk factor than the ones that are open, it's not fair that they remain closed. And I hope that this report will open the governor's eyes to that.
Great, thank you, Senator. And I believe you just also answered Mayor Asdahl. Her question was similar to that in terms of, how receptive will the governor be, or are they just going to rely on their own experts?
Well, listen, there's that old adage, the squeaky wheel gets the grease, right? So that's why I'm encouraging everybody. I know my colleague from the Assembly, Assemblywoman Dunn, was on the committee, and I know that she supports the plan. We just need now to not only get all of our other colleagues on board and to ask for their help, but we need the business community to do the same. And I hope that as this report gets shared around the state, that people will recognize this 80% factor as not being fair. And, sometimes you can see something and not really see it, but when it's as simple as that 80% of the businesses that are closed have a lower risk factor than those that are open. When you hear that, it's really hard to argue with. So I hope that if there's one takeaway, that's it. And I hope that folks, key in on that and use this plan that the chamber put together to move the governor's office in a different direction.
Senator and Mike, if I could just build on that a little bit, that there was a question also about working with other counties and so forth, since we're Morris County, and Meghan and Mike have developed, and Paul Boudreau before developed the Morris County Chamber with a reputation as really state-of-the-art in advocating for business, and because of that, they continue to work well with the New Jersey State Chamber, the NJBIA, Somerset Partnership, CIA, NJ, other well-known statewide business groups, and we've advised them of this forum, and many of them are on this call, and they're happy to collaborate with us to advocate for these findings. And I don't know if you or Meghan want to build on that, or Senator.
Look, there was a reason I came to the Morris County Chamber 2.5, 3 weeks ago. I've been a part of the Morris County Chamber my entire career, both professionally and politically. So I can tell you that there's a reason I came to the Morris County Chamber, and that is because I had confidence in the folks that run the chamber and the members of the chamber to be able to help me and guide me in this process. While we sometimes like to think we know everything we need to know, I've learned really quickly during this crisis that there's an awful lot out there that I have no idea what's going on. And I came to the spot where I knew I could get the answers, and I knew I could get them in a sound manner, something that I could get behind and get other people to get behind. And the chamber has absolutely delivered that from the very beginning, from finding the best and the brightest experts, from bringing the best and the brightest business leaders to the table to make this happen. And and you see the result of it today with this plan. So I do hope that the chamber shares it. I hope that the folks on this call today share it, and we'll be releasing it and getting it out. Excuse me, to everybody. And I hope that it has an impact, because I think our small business community and the economy in New Jersey needs it desperately at this point.
And Alan, I just want to thank the senator for his leadership and his advocacy. It's so important to have partners in the legislature for us to be able to move these kinds of plans forward. I also want to remind everyone that we do have an economic development corporation that is a division of the chamber. So being pro-business, advocating on behalf of our members and businesses in the county is part of our DNA. And we're fortunate to have that relationship, which is a public-private nonprofit partnership with the freeholders and the business community. And yes, we are also fortunate to have an excellent working relationship with the New Jersey Business and Industry Association. I actually received an email from Michelle Stakirka during this presentation, and also with the State Chamber. So we're grateful for Tom Bracken's leadership as well. And I know he also serves on one of the governor's advisory committees. So yes, we're looking forward to disseminating this report far and wide. So thank you.
Thank you, Megan. And you know, when you hear from the State Chamber, you hear from NJBIA, we're all in this together. And that's why this process was so important to me, to be able to put forth Morris County's vision, business community's vision to reopen the economy, sharing it with those organizations, and having those organizations be a part of this process is critical to getting this state moving, because we are all in this together.
Great. So thank you. We're coming up towards the end here. The last couple of questions, you just pretty much eloquently answered them without knowing what they're going to be, but a lot of questions are next steps, what can we do? Can I start a petition? I like your, you know, the squeaky wheel gets the grease, Senator. So any closing comments from you, sir, before we wrap it up?
I just want to say thank you. A lot of time and effort went into this report and presentation, and I can't thank Bruce and his team enough for the expert advice that everybody put forth and the time that everybody put forth. You know, last night at 8 o'clock, we were all on a call putting the final touches on this plan. You know, my wife wants to redo the kitchen because she says people are seeing so much of the kitchen. She thinks that we could have a better kitchen. So I don't know about that, but you know, I mean, this is what it's all about. And this is about people's lives. This is about people's livelihoods. You know, I mean, there's no greater need than to be able to provide for your family. And I hope that the work that we've done over the last 2.5 weeks gives some folks some hope and moves the governor's office. Thank you.
Great. Thank you all, and have a wonderful day.